Hey, good morning, Bucks. This is Mr. Lavery. I'm talking to you from my spare room because I'm scanning documents. I'm scanning the first aid book to make things a little easier next week. We'll go back and forth, taking some very brief notes on sudden illnesses um, and how they affect people and how you can help them. We're going to talk about diabetes, seizures, stroke, heat and cold related emergencies. A sudden illness can be acute, it comes on suddenly. And we talked about chronic breathing emergencies. So they could be issues that people have chronically with triggers that make things go from good to bad real quick. And we're going to talk about the science behind them. So, um, signs and symptoms of sudden illness: trouble breathing, pain in the chest, changes in level of consciousness, lightheadedness or dizziness, nausea, fever, pale or flushed skin, problems seeing, speaking, numbness, and seizures. Seizures are a sign and symptom of other things. So the biggest thing is that we interview the bystanders and go through sample and then check the person from head to toe. So kind of again, we're taking everything we've learned and we're using it again and again. Um, so fortunately, we do not need to know exactly what is wrong to help. Okay. The big thing is the number one rule is do no further harm. Monitor the person's breathing and level of consciousness. Help the person rest in the most comfortable position. Keep the person from getting chilled or overheated. Reassure the person that you will help that and that EMS personnel have been called. Give care consistent with your knowledge and training as needed, and continue to watch for changes in the person's condition. And the biggest thing is remember, do no further harm. So if they were in a serious accident and we don't have to move them, we don't move them. Just have them lay there in the position you find them if they're comfortable. Um, and we go through sample signs and symptoms, allergies, medications, pertinent medical history, last food or drink, and events leading up to the situation. So, um, sudden illnesses can lead to shock. And we talked about this before breathing emergencies. Shock is any serious illness or injury um, that is going to disrupt the blood flow or the oxygen levels in the body or homeostasis. So we will talk about homeostasis. And again, much like the signs and symptoms before, it can include restlessness and irritability, changes in level of consciousness, pale, ashen grayish, cool, moist skin, rapid breathing and heartbeat, excessive thirst, nausea, or vomiting. So remember, do no further harm. Have the person lie down if possible. If we have to, call 911 immediately. Control the bleeding if necessary. Cover the person with a blanket to prevent loss of body heat. Do not give the person anything to drink or eat, even if the person complains of thirst. Reassure the person until EMS personnel arrive. Now, this bullet we might have to change if they're diabetic or if there's a heat or cold related emergency, um, or they're dehydrated. We might have to give them something to eat or drink. So that's why going through sample is very important. And you can help somebody. Big number one rule is do no further harm. So good luck this unit. We're going to take some notes today briefly, and then we're going to get into diabetes.